Hey everyone, and welcome to this explainer. Today, we're putting on our medical detective hats to decode the hidden physiological distress signals in your dog's scent. Look, we absolutely love our dogs, right? But sometimes the messes they leave behind can tell us a whole lot more than we might realize. So today, we're looking past the mess itself and really focusing on the science of smell. So, let's dive right into this incredibly fascinating question, one that practically hits every pet owner right in the nose the second they walk into a room. You know that sharp chemical odor that literally makes your eyes water? Well, it's not just a housekeeping nuisance. It is quite literally a chemical distress beacon coming straight from your dog's body. If your dog's urine suddenly smells overwhelmingly like a bottle of ammonia, they are trying to tell you something really important. To figure out what that is, our biological investigation today is going to cover the ammonia odor mystery, establishing a healthy canine urine baseline, 4 common medical culprits, reproductive and prostate risks, veterinary diagnosis and treatment, and finally eradicating persistent carpet odors. Okay, starting off with section 1, the ammonia odor mystery. To really understand this, we have to look at the chemistry, because the life cycle of this odor all starts with protein. When your dog's body naturally metabolizes proteins, it creates toxic ammonia. To protect the body, the liver cleverly converts this into a less toxic substance called urea, which then gets expelled in the urine. But here is where it gets crazy. Once that urine hits your carpet, the chemistry experiment actually continues. Canine urine combines ammonia, bacteria, hormones, and uric acid. And as it dries and breaks down, the ammonia becomes super concentrated and releases this putrid sulfur-based gas called mercaptan. That mercaptan gas, that is exactly what's assaulting your senses. Moving on to section 2, healthy canine urine baseline. Before we can spot the problems, we have to know what normal looks like. Healthy dog urine should be clear to yellow, have a relatively mild odor, and be produced in pretty predictable volumes. But on the flip side, we have some major warning signs. Dark yellow urine, that usually means your dog is dehydrated. Perfectly clear urine, though, can actually indicate an inability to manage urine concentration, which is often tied to excessive thirst and urination, a condition vets call PU/PD. And if the color suddenly shifts to cloudy, orange, or red, that is a massive red flag for things like bladder stones or internal bleeding. Which brings us to section 3, 4 common medical culprits. So if you're smelling that ammonia, it usually points to one of 4 hidden suspects. First up, urinary tract infections, which cause major discomfort and that foul smell. Second is simple dehydration. Less water means highly concentrated, dark urine that absolutely reeks of ammonia. Third is chronic kidney disease. When the kidneys start failing to filter out waste, toxins build up in the blood. This state is called azotemia, and it doesn't just make their pee smell. It can actually give your dog uremic, ammonia-like breath. And finally, suspect number 4, bladder stones. These irritate the urinary tract, and some, like struvites, actually form in concentrated urine and require a specially formulated low-purine diet to manage. Now, get this. An incredible 14% of the entire canine population will develop a urinary tract infection at some point in their lives. That's a huge number, making it the single most frequent culprit behind that foul odor. If you smell ammonia, a UTI really needs to be one of the very first things on your radar. Let's look at section 4, reproductive and prostate risks. Gender-specific anatomy adds a whole other layer to this mystery. Think about the internal layout for a second. You have the urinary bladder, and sitting right next to it in male dogs is the prostate gland. Prostate disease is actually incredibly common in older, unneutered males. Because the prostate sits so close to the urinary tract, if it becomes inflamed, infected, or enlarged, it presses directly against the bladder and urethra. That physical pressure and inflammation, it can lead to bloody urine, difficulty going to the bathroom, and frequent super stubborn UTIs. For female dogs, the risks are entirely different, but equally, if not more, severe. We absolutely have to talk about pyometra. This is a life-threatening uterine infection that mostly affects middle-aged or older unspayed females, usually driven by E. coli bacteria. If it's what's called a closed cervix pyometra, that infection is trapped inside. This can cause endotoxemia and even acute kidney injury. Owners will often notice lethargy, increased thirst, and sometimes a foul-smelling, chocolate-colored discharge. Guys, this is not just an odor issue, this is a surgical emergency. This leads perfectly into section 5, veterinary diagnosis and treatment. Once you've noticed these aromatic clues, it is time to bring in the pros. As veterinary expert Dr. Linda Simon points out, a simple urine culture is often the first vital step here.
You don't have to sit around guessing what's happening. Your vet can literally culture the bacteria to see the exact strain you're dealing with.
Vets have a pretty amazing toolkit to pinpoint the exact issue. They'll run blood tests to measure bun and creatinine levels, which are absolutely crucial indicators for how well the kidneys are filtering. They'll do a urinalysis to check concentration, pH, and look for proteins. They might even use an ultrasound to physically look inside the bladder and kidneys for cysts, stones, or tumors. Based on the findings, treatments can range from targeted antibiotics to highly specific diets designed to dissolve those crystalline struvite bladder stones we mentioned earlier.
All right, finally, Section 6, eradicating persistent carpet odors.
So, you've solved the medical side for your pet, but now we have to tackle the crime scene left behind on your rug. It's actually fascinating. You can use a UV black light to find the hidden source of the smell. Even if you can't see the stain in normal lighting, the phosphorescent proteins left behind in old urine will glow brightly under a black light. It's like a treasure map for exactly where you need to clean. And here is where the chemistry really matters. Standard household cleaners or even the classic baking soda and vinegar trick might mask the smell for our human noses, but they leave non-water-soluble uric acid crystals trapped right there in the carpet fibers. Your dog's incredibly sensitive nose will still smell it, and I guarantee you they will keep peeing in that exact same spot. You absolutely need products containing a specific enzyme called uricase. Uricase is basically a catalyst that digests and dismantles that stubborn uric acid at a molecular level, literally breaking it down into harmless carbon dioxide and water. Following these 3 precise chemical steps is the only way to ensure you completely neutralize that putrid mercaptan gas. Step 1. Treat it immediately with a specialized bioenzymatic, mineral, or oxidizing cleaner. Step 2 is absolutely critical. Urine soaks downward, right? So you have to apply enough product to penetrate deeply into the carpet pad and the subfloor where the urine is actually hiding out. And step 3. Blot it up with towels and speed dry the area with a fan so that trapped moisture doesn't turn into mold. So, as we've seen today, a sudden, strong ammonia odor is way more than just a cleaning chore. It's a window into your dog's internal health. From dehydration and UTIs to kidney disease and severe reproductive infections, that smell is your dog's biological distress signal. It really leaves us to wonder, as we go about our daily routines with our pets, what other vital health secrets are they trying to communicate to you if you just know how to listen? Or, I guess in this case, smell. Thanks so much for joining me on this explainer, and I'll catch you next time.